Welcome to the second video in our three-part series on CAR T-cell therapy and lupus. In our first video, we explained that lupus is a long-term autoimmune condition where B cells produce antibodies that mistakenly target the body, causing inflammation. Now, we'll look at CAR T-cell therapy, a potential treatment being studied for lupus. T cells, like B cells, are special immune cells that help fight infections. But unlike B cells, T cells don't make antibodies. They detect and destroy infected cells directly. CAR T-cell therapy uses a person's T cells to target and destroy harmful cells. CAR stands for chimeric antigen receptor, a special tool added to T cells to help them find specific targets. CAR T-cell therapy has been used successfully to treat blood cancers that affect B cells. And because lupus also involves faulty B cells, it's being studied for use in people with lupus. By destroying harmful B cells, CAR T-cell therapy could potentially reduce inflammation and damage caused by lupus. CAR T-cell therapy is a long and complex process, so let's go through it step by step. Firstly, treatments that dampen the immune system, known as immunosuppressants, often need to be stopped before CAR T-cell therapy. This may be needed anywhere between 1 and 8 weeks prior to starting CAR T-cell therapy. Although stopping your current treatment may feel unsettling when you have depended on it for so long, it is vital to increase the quality and quantity of your T cells. If you do need to stop any treatments, your healthcare team will let you know and will carefully monitor your health. Next, T cells are collected from the blood using a procedure known as leukapheresis or apheresis in a hospital or special treatment center. Blood is drawn from a vein in one arm and passes through a machine that separates and collects the T cells. The rest of the blood is returned to the body via a vein in the other arm. This can take between 2 and 6 hours. The collected T cells are then sent to a lab where they are changed into CAR T cells, then multiplied until there are millions of them before being purified, tested, and sent back to the treatment center. This could take several weeks. Before the CAR T cells are returned to the person with lupus, conditioning treatment, also known as lymphodepletive chemotherapy, is given in a hospital ward or clinic. This reduces the number of natural T cells in the body, giving the modified CAR T cells a better chance of working effectively. Each session takes up to 30 minutes and is usually needed once a day for 3 to 5 days. The CAR T cells are then passed back into the person's blood through a drip into a vein. This is known as an infusion and is usually done in a hospital by a specially trained nurse. It takes up to 30 minutes. Afterwards, the person will be closely monitored for side effects and effectiveness of the therapy, typically staying in hospital for 2 to 4 weeks. As we learn more about CAR T-cell therapy, there may be some changes to this process. Researchers are trying to find ways to reduce the length of hospital stays, and it's possible that T cells could be taken from a healthy donor instead of the person with lupus. CAR T-cell therapy is a relatively new treatment even for cancers, and there's limited data on its use for lupus. In Germany, a small trial involving 5 people with lupus showed positive results, and there are several planned or ongoing trials, including in the UK. As more data is gathered through these trials, we'll better understand the risks and benefits. Like any treatment, CAR T-cell therapy comes with potential side effects ranging from mild to severe. Potential common side effects include complications of the nervous system, low numbers of blood cells, and an increased risk of infections. There are also risks from stopping existing medications and from the chemotherapy used in conditioning treatment. Despite these risks, researchers hope that CAR T-cell therapy will reduce or even remove the need for lifelong medication for people with severe lupus. For many people, the potential benefit of drug-free remission may outweigh the risks. To learn more about how CAR T-cell therapy is being studied, watch the final video in this series.